Paragonimus westermani, or also known as the lung fluke, represents one of the most injurious of foodborne helminths. These flukes cause paragonimiasis in people and other crab-eating mammals in Asia, parts of the West Africa, and South Central America. About 20 million people are infected with lung flukes, and estimated of 293 million people are at risk. There are about 15 species of Paragonimus known to infect humans, and P. westermani infection is the most common elsewhere. The organism is a freshwater species that infects the crabs and crayfish as their intermediate hosts. The disease is transmitted to man via ingestion of this crustacean, although cases may be seen that are due to ingestion or contaminated seaweeds or any kind of crustacean that is infected. The larvae mature in the bowel and migrate through the diaphragm and infects the lungs. Paragonimus is a large 10 micrometer reddish fluke. Its wall consists of tegmentum with prominent spiny projection, best seen on high power examination of trichrome stain section. It exhibits prominent and oral ventral suckers and a loose external stroma. The worm involves a cystic necrotizing granulomatous and fibrotic response with tissue eosinophilia. The ova of Paragonimus are 80 mm in diameter and show a flattened operculum. They are also intensely bifringent under polarized light, and this is an important distinguishable factor. Life cycle. When the Metasecariae infected crustacean hosts are eaten raw or undercooked by the final host, man and mammals, especially Felidae and Canidae, the Metasecariae exist in the small intestine and penetrate through intestinal wall into the abdominal cavity prior to migration through the subperitoneal tissues, the muscle, the liver, the diaphragm, and finally enters the lungs, where maturation occurs. Adult flukes lay eggs, which are coughed up and injected by spitting with the sputum or swallowed and passed in the pieces. In the water, the immature eggs develop into myracidia, freely swims and then invade the freshwater snails. In the crustaceae, such as freshwater crabs, crayfish, and shrimps, probably acquired the infection by consuming free-living cercariae or eating infected snails containing the fully developed Microcercus cercariae. The cercariae then develop into Metasecariae. The infective stage reservoir hosts including cat, tiger, dog, and rodents can be affected by eating the Metasecardia. So let's proceed with the clinical symptoms of P. westermani. The clinical symptoms is pulmonary type, meaning the symptoms resemble pulmonary tuberculosis with low fever, loss of appetite, light sweating, chest pain, loss of weight, and rusty sputum. Abdominal type, abdominal pain, diarrhea or dysentery with blood and mucus. Subcutaneous type, the wandering and painless subcutaneous nodules. Brain type, epilepsy, hemiplegia, and aphasia. Okay, so now we will proceed on how P. westermani is diagnosed. First, we have the sputum examination, direct sputum smear, alkali digestive method, 10% NaOH. Next, we have the stool examination, direct fecal smear, alkali digestion, water sedimentation method, biopsy for subcutaneous type, CT for brain type, immunological test for reference. Okay, so now we will proceed on the treatment. There are two anthelmintic drugs, praziquantel and triclabendazole. They are both recommended by WHO for treatment for paragonymous infection. So let's proceed with praziquantel, given in a dose of 20 mg of body weight for 1 to 3 days, produce a cure rate of 70 to 100%. In triclabendazole at a dose of 10 mg daily for 3 days result in cure rates of up to 98.5%. To prevent and control this kind of situation, we have to cook crabs and crayfish for at least 145 Fahrenheit to 63 Celsius. Avoid sputum and stool getting into the water. Travelers should be advised to avoid traditional meals containing undercooked freshwater crustacean. Control of reservoir hosts. Epidemiology. So human paragonimiasis occurs in 3 endemic focal areas. In Asia, we have China, Korea, Japan, Philippines, Vietnam, Taiwan, and Thailand. In South and Central America, we have Ecuador, Peru, Costa Rica, and Colombia. In Africa, we have Cameroon, Gambia, and Nigeria. These are the endemic areas, can be identified as the people eat raw, pickled, semi-cooked freshwater species of crabs, crayfish, and shrimps. In the Philippines, kinagang, which is a semi-cooked freshwater mountainous crab, are eaten as an appreciated dish in the Philippines. Human disease are caused by 2 species, P. westermani and P. philippiniensis. And lastly, we have the facts. A unique species only endemic in China, about 15 province reported cases. Subcutaneous type is the most common clinical features. Diagnosis through skin biopsy, and praziquantel is the choice for treatment of this infection.